Thank you again, Dr. Josephine, for that wonderful presentation. Again, the theme of our conference is partnership. Can you hear me now? Yes. Good, sorry about that. Again, thank you, Dr. Todd, for that wonderful presentation. Again, this theme will keep coming up over and over. It is the theme of our conference, partnership in healthcare diversity. How do we, as internationally educated nurses, partner with the Canadian health system to enrich it, to make a difference, and to bring our skills and make them and put them to good use? At this time, I'd like to acknowledge any board members that are here. Salim is here. Thank you, Salim. Any other care board members that are here? See a little more of her later. And I'll take this time to acknowledge our former Executive Director of Care, Zubaida Ramji, who has been quoted thank you, Zubaida. You heard about her, so that's Zubaida Ramji. She's the former Executive Director of Care. At this time, I will introduce the board member that I knew was here, Ms. Ella Ferris. Ms. Ferris is the chair of the Joan Lesmond Award, is the chair of the Joan Lesmond IEN of the Year Award Selection Committee and the Care Center board member. She has been with St. Michael's Hospital since 1972 when she joined as a staff nurse following her training at the St. Michael's Hospital. She was appointed Executive Vice President of Programs and Chief of Nursing in March of 2006. In 2001, Ms. Ferris was seconded as the Health Reform Implementation Team of the Ministry of Health and Long-Term Care, where she gained experience in health systems planning and health service integration. Ms. Ferris was honored with the Ontario Hospital Association's R. Ellen Hay Memorial Hospital Executive Award in 2005. She holds a Master's in Business Administration from the Richard Ivey School of Business at the University of Western Ontario. Please join me in welcoming Ms. Ella Ferris.
Thank you very much for that introduction. And now this is a really exciting part of the program today, because what you're going to hear about in the next 15 or 20 minutes is really the stories that Josephine and also Derek reminded us of. It takes courage, resilience, and inspiration for the individuals that you're going to hear about in the next few moments to really accomplish what Josephine has really outlined as a challenging and difficult journey. So these are men and women that you will be truly inspired by. And I think in the room today, during the breaks, maybe try to at least leave today hearing the personal story of someone that you didn't know when you came. And that can be on either side. That can be on the side of the challenge that Josephine gave us to better understand what it is to be an IEN, to better really change the circle that we're trying to put the peg in, because we are the circle if we're already here, and we are the privileged. And you've heard about my career, 42 years in one organization where I actually trained, where I actually started to work when I was 14. So my journey's been really quite easy against the journeys you're going to hear about today. So let's both be mindful of how we can take our stories and bring them together for the individuals, and most importantly, that we value the knowledge, the experience, and the skills that our IENs bring to our healthcare system. And that's what these awards are all about. So I'm delighted to be a member of the Board of Care, a privilege to be a member of that board, and to work with the members of Care who truly hold the hand and inspire those IENs who come to this country to work. So now the stories. So 4 years ago, CARE did decide during its annual 10-year celebration that it was time to publicly acknowledge the excellence that the IENs bring to our healthcare system. And out of that was born the Joan Lesmond IEN of the Year Award. And I'll share a little bit about Joan later on in my presentation. But I want to start by recognizing our first member who was awarded the first IEN Joan Lesmond Award of the Year, and that's Loy Asheri, who you've already met this morning, and you will also have the opportunity to hear more about her personal story. So after winning the award, and Loy was recognized by her peers, by her managers, and the team she worked with at the ICU in Sunnybrook. And after that, she was inspired by CARE to actually become a part-time case manager with CARE. So thank you, Loy, and we'll hear more about that later. Next, we traveled to London and had the honor of awarding the award to Ismail El-Assad, an IEN from Palestine, working as an RN at the University Hospital and pursuing his graduate studies. In 2013, we celebrated Etzel Mutia at North York General, where he works as an RN. At that time, he was leaving there to go and volunteer in his home country of the Philippines to actually help those who were devastated by the terrible Typhoon Haley. Last year, at our first IEN conference, which this is our second, we decided that it would be really appropriate to award these awards during the ceremony and during the event. And we also decided at that time, because our two previous winners had been RNs, that we should actually have two categories of awards, one for an RN and one for an RPN, so that we could recognize what both skills and abilities of the individual professions bring. So we were very excited at that time to have two awards. And I'm going to invite up to the stage now the two winners from last year, Ahmed Baki, and he's an RN from Iran, and an oncology specialist at the Princess Margaret Hospital, and Adela Belicero, an RPN from Peru, who works in complex continuing care at Bayshore Health Services. The two of them will pass the torch, and they will make the awards, and the plaques will be given by them to this year's award winners. So please join me on the stage. That's the other thing. They're always so humble about their excellence, you know. Notice me, I came right up. I was ready to get on the stage, and they're just quietly coming up, you know, to be recognized, you know. So here we are. Come up here. You're in the spotlight. So just so everybody knows who we have here, I'm really happy to again introduce Adela Belicero.
Thank you so much.
You're welcome. Our RPN from last year, and of course our RN winner, Ahmed Baki.
Thank you very much.
Thank you for being here. And I also would just like to take a moment to publicly acknowledge the members who are not CARE board members necessarily, but who are very interested in the plight of IENs and dedicate their time to help us choose these very worthy recipients of the award. So Andrea Bowman is at McMaster University, and she leads the Nursing Health Services Research Unit there. And I don't know if any of these people are in the audience. I know one person is, but if you're in the audience, please stand as I say your name. Doris Greenspoon from the RNAO, the CEO there. Diane Martin, RPNAO. And I know Elaine Satamina from Ryerson is here, thank you. And Lucia, who is a board member alongside myself from the University of Windsor. And of course, we always have our current year winner help us in our selection of the next year's winner. So we were really happy to have both Adela and Ahmed with us on that. So I would really like to congratulate the Care Center members, IENs, who were also nominated this year. And it is a difficult choice because, as I say, these are stories of courage, resilience, and inspiration. And it's always humbling for all of us on this committee because we say, would we have that courage, resilience, and inspire others if we had to go to another country to work. And I'm not sure I could do it, and I'm a pretty tough lady. So I really think that I want to, be sure that we do recognize all of those that were nominated. Leslie Alcantara, Kalita Fraser-Howard, Shrang Shang, Raymond Digby, and Gaynor Quiros. And I think that Gaynor might be in the audience today. Is Gaynor here? And if he is, I think we should, should definitely acknowledge. And that's a very good reminder, because I don't know about others, but often names, in our culture, names kind of help to identify very quickly male or female. And I just made a very big faux pas, and I apologize for that. But it happens, so it's always to be acutely aware that we know who it is we're speaking of. So thank you for that. And so next we go on to acknowledge our award winner. But in the name of Joan Lesmond was an RN, and she worked in many sectors in healthcare, and she was truly an inspirational leader. She did immigrate from another country, but she did her training here in Canada. But she very quickly became engaged with CARE when CARE was initiated. And for her leadership in healthcare, Joan Lesmond was actually awarded the YWCA Women Distinction Award. And it's really quite inspirational if you had the opportunity to know her. And we wanted, through CARE, to really remember her legacy, value her legacy, and ensure that we really held her up as a model of excellence. And anyone who's winning the award in her name can be very proud that they are in exceptional company, having Joan Lesmond as the person that they have been modeled against. So now I'm going to get to introduce you to our award winners. Rupali Krishna is an RN from India, and Alex Lamson, an RPN from the Philippines, and I think they should also join me now on the stage. Here she comes. Okay. I'll just keep talking to keep us on schedule while you make your way up, so thank you for joining us on the stage. And these inspirational nurses, as I say, are following in the footsteps of Joan Lesmond. And can you? There we go. Thank you. So I'm going to first acknowledge Rupali. And it's a pleasure, Rupali, to introduce you to the audience here today. And this inspirational nurse was actually, at one point in her career, the nursing officer for the Indian Army of Lieutenants. So these are people who have really showed their excellence in their own country. And I think to Josephine's reminder that these are leaders in our healthcare system and should be recognized leaders in our decision making. We know that it's been a long and hard journey for you to achieve your nursing license here in Ontario. And when we read the story about you taking public transit during the dead of winter while you were pregnant with your son, who I think we know is here because we can hear him, which is lovely. Hi, there you are. And then also at the same time caring for your other son, who's also with us today. So very proud of their mother, and it's wonderful to have them here to celebrate. But thank you for persisting, for believing in your chosen profession, and making sure that those here in Canada that have the pleasure of working with you at Dover Cliffs Long-Term Care can learn from you. And we know that those who are providing care alongside you have recognized your excellence, and that those clients that you serve know how lucky they are when they see you coming through the door. Come on up. You'll help with the mean age. You'll bring us down a little bit. Great, thank you. So I think we will go ahead now and make the award. And I'm told everything is here. This one's for Rupali. So, okay. Thank you. So thank you very much. And we'll have the opportunity to take a few more pictures with Rapelli and her family later, I'm sure. So congratulations. Thank you. Very proud of you.
Thanks.
Thank you very much. So next we have Alex. And Alex works at Shalom Village and was voted Rookie of the Year. And I think, again, this is a lovely example of how organizations can recognize excellence by having this kind of award, which is, again, a nomination from your peers. So good examples of things that you can all take back to your work environment. So as the award winner, Alex worked in a government hospital in the Philippines, in the emergency department and the operating rooms, as well as delivery rooms, all high-pressure environments. Alex is now affiliated with several other institutions, working as an RPN, teaching, or involved in research. So no wonder that at one point the Hamilton Health Spectator wanted to profile his successful new Canadian career and hopefully also acknowledge his wonderful career that he already had lived in his home country. Alex, please join us as we acknowledge you and say thank you for this well-deserved applause.
Thank you.
Do that?
Thank you so much. It's my pleasure. Thank you. This is for my parents.
Who should be very proud of you. So this concludes this very special part of our program today. And thank you all for what you do every day to inspire one another. And thank you for being here, because it means that this is an important part of your commitment to the Canadian healthcare system. So thank you for everything. Enjoy the rest of the day. Did you either of you want to make a little comment?
Thank you very much,
Okay.
Ms. Ella Fair.
I'm going to give them a moment. I know we're on a tight schedule, but would they have a moment to just say something? Is that all right? Okay.
Thank you so much. Good morning, ladies and gentlemen. What a wonderful day. And I am deeply honored to receive and accept the Joan Lesmond IEN of the year 2015 as an RN. I convey my heartfelt gratitude to the Almighty God and our Guru Shirdi Sai Baba for divine blessings showered on us. I thank my departed parents as they shaped me as a professional as I am today, and my late father-in-law, whose guidance helped me in many ways in my career. I thank my mother-in-law, Mrs. Nipa Mukhopadhyay, sitting in the audience today, for having immense confidence on me as a nurse. There is a saying, behind every man there is a woman. But for me, it's the other way. If my husband, Dr. Ranjit Krishna, would not have supported me towards the goal, I would not have been here today. I thank my elder son Arjun for helping me in every stage by excelling in his studies without giving me any stress till then. And also my younger one, Amitav, for being a very good boy and bugging his dad more than me. I thank my family in India for their unlimited trust in my ability. I thank my extended family in Canada, Mr. Akhtar Mahal and Mrs. Mohanjit Mahal, who are present here today with me, for accepting me as their daughter and doing everything in Canada that my parents did for me in India for my life and career. I convey my thanks to our respected family members, family friends, Mr. Ashok Bhanot and Mr. Sudarshan Bhanot. They are also here today with me for their constant guidance in this journey. There are many more friends and acquaintances who helped me in some way or other. Without them, this journey would have been difficult, and I thank them too. I would like to thank my ELT teacher from NCP, Mrs. Vicky Brooks. She is sitting in the audience, for not only teaching us about Canada and labor market, but also connected to care for nurses. I thank my first employer, Mr. John Visa and Mrs. Sahar Enalner from Total Health Pharmacy for their timely help and support. I would like to thank my ED, Mrs. Pauline Robinson. She is here to grace the occasion today. From Dover to Long-Term Care, Port Dover, for accepting me as a newcomer RN in the facility without a Canadian experience and nominating me for this award. I also thank my colleagues and all staff, including PSWs and other team members of Dover Cliffs, for helping me and guiding me every moment in my journey as a new RN. And I also thank the lovely residents and the families of Dover Cliffs Long-Term Care for accepting me as their family despite of my non-Canadian accent. Care for nurses has done a phenomenal job in my career as RN. And here I want to say, I met Mrs. Ramoji and Norma in Mississauga Chinese Center in 2010. And that was the beginning of my journey. And if I'm allowed to single out one person, that's Norma. She chalked out everything. She is the one who literally chalked out my whole journey from a newcomer to RN. And as destiny would have, I got pregnant during my preparation. So she had an alternative strategy too also, so that I can continue my preparation without any problem. And because of care, because of Norma, my journey from an immigrant nurse to RN took only not even 2 years. And I give all the credit to care for this. They have got excellent, very excellent way to guide the nurses, and they're doing a very good job. And because, and last but not the least, I thank my alma mater, College of Nursing, Armed Forces Medical College, India, for giving me valuable insight, just not limited for nursing, but in terms of strict discipline, that helped me to follow the uncharted path as RN in Canada. I was a nursing officer in Indian Army, resigned as major with 14 years of active service. After I landed here, I asked myself, what is my next milestone in life? I never wanted to be only ATM, just get a paycheck at the end of the month. I want to add value to my life and my profession. The moment I was nominated for this award, I remember the famous line from the book by Rhonda Byrne's Secrets: whatever you ask from the universe, consciously or unconsciously, universe fulfills your wishes. This award is like answer of the query by letting me know that now I have more responsibility to give back to the society and the people. Today, in front of the August gathering, I would like to reaffirm Florence Nightingale's pledge that I took 25 years back when I began my journey as nursing cadet in Indian Army. Amen.
Thank you, Rupali. We're all a little bit wiser for your words. Thank you so much. Alex, could we give you a moment?
Sure. Hello, everyone. First of all, I would like to thank my parents for coming here, for all their hard work, for sending me to university, and for supporting me to whatever path that I take. Thank you very much. I love you, Mom and Dad. To my Care Hamilton family, for Joan, for Lourdes, and for Adila, and also for Sadie, who has been part of my success. Thank you very much for, they are the first organization that I went to after 1 month of staying here in Canada. Due to the lack of time, I'll just leave you a quote. Let me quote you what the wise man said: the adventure of life is to learn, the nature of life is to change, the purpose of life is to grow, and the challenge of life is to overcome. In summary, life is a kaleidoscopic process of education, source for the infinite dedication to knowledge, experience, and for the truth. I'm truly grateful for CARE, for truly advocating for internationally educated nurses, and I hope in the future or soon, the College of Nurses should be a good friend of internationally educated again, I hope CARE would be here forever to take care of the internationally educated nurses. Thank you very much, everyone.
Thank you, Alex. I think both Alex and Rupali have demonstrated that if we do as Josephine has invited us to do, just listen, we will learn, and we will create the environment that has every IEN that's living in Ontario working in the healthcare system. So thank you all for being here and hearing these wonderful stories, and thank you both.
Thank you, and congratulations to all the winners for this year.